Have you ever wondered why blood pressure is such a crucial health indicator? It's one of the first things checked at every doctor's visit, and for good reason. High blood pressure, or hypertension, is often called the silent killer because it can develop without noticeable symptoms while significantly increasing the risk of heart attack, stroke, kidney failure, and even aneurysms. Many people live with high blood pressure for years without realizing the danger it poses, which is why awareness and prevention are so crucial. The consequences of unchecked hypertension are severe, affecting not only the heart, but also other vital organs like the brain, kidneys, and even the eyes. If you're new here, don't forget to like, subscribe, Health Info Hub, and turn on notifications to stay updated with our latest health tips. Before we begin, just a quick reminder, we are not medical doctors. This discussion is for informational purposes only. Blood pressure is the force exerted by circulating blood on the walls of your arteries. It is a vital measurement that helps determine the overall health of your cardiovascular system. It is measured in millimeters of mercury and recorded with two numbers. The first number, known as systolic pressure, represents the pressure in your arteries when your heart beats and pumps blood. This is the higher of the two numbers. The second number, called diastolic pressure, measures the pressure in your arteries when your heart is at rest between beats. A normal blood pressure reading is typically less than 120 by 80 millimeters of mercury. Anything higher can indicate elevated or high blood pressure, increasing the risk of cardiovascular issues. Maintaining blood pressure within a healthy range ensures that your organs receive a steady supply of oxygenated blood, which is essential for their proper function. Blood pressure follows the Goldilocks principle. It shouldn't be too high or too low. If it's too low, organs may not receive enough oxygen, leading to dizziness, fainting, and shock in severe cases. If it's too high for a prolonged period, it can damage blood vessels and lead to severe complications such as heart attacks and strokes. High blood pressure can cause arteries to harden and narrow, limiting blood flow to the heart and brain, which increases the likelihood of cardiovascular diseases. The kidneys also rely on healthy blood flow. High blood pressure can damage the tiny blood vessels that filter waste, leading to kidney disease. Another serious consequence of high blood pressure is aneurysms. Excessive pressure can cause weak areas in arteries to bulge and rupture, leading to life-threatening emergencies. These complications highlight the importance of keeping blood pressure in check through a combination of lifestyle changes and medical supervision. Accurate blood pressure readings are essential for monitoring your health. To measure it properly, you should sit comfortably in a chair with your back supported and feet flat on the floor for at least 5 minutes before taking a reading. Avoid caffeine, smoking, or exercise for at least 30 minutes before measuring, as these activities can temporarily elevate your readings. It is also important to use the right equipment. A properly fitting blood pressure cuff should be placed on a bare arm at heart level. Staying still and silent during the measurement is crucial to ensure accurate results. If you are measuring at home, take readings at the same time each day and keep a log to share with your doctor. Monitoring your blood pressure consistently can help detect trends and alert you to potential issues before they become serious. While hypertension is often symptomless, extreme cases may cause headaches, dizziness, or nosebleeds. However, many people with high blood pressure do not experience any symptoms until it reaches dangerous levels, which is why regular monitoring is important. There are different stages of high blood pressure. Elevated blood pressure is when systolic levels are between 120 to 129 millimeters of mercury, while diastolic remains below 80 millimeters of mercury. Stage 1 hypertension occurs when systolic levels are between 130 to 139 millimeters of mercury, or diastolic levels are between 80 to 89 millimeters of mercury. Stage 2 hypertension is diagnosed when systolic levels are 140 plus millimeters of mercury, or diastolic levels are 90 plus millimeters of mercury. A hypertensive crisis occurs when systolic levels reach 180 plus millimeters of mercury, or diastolic levels exceed 120 millimeters of mercury, requiring immediate medical attention. Identifying and treating hypertension in its early stages can help prevent serious complications down the road. Maintaining a healthy lifestyle is one of the most effective ways to keep blood pressure in check. Regular exercise plays a key role in blood pressure management. Engaging in at least 150 minutes of moderate intensity exercise per week, such as brisk walking, jogging, or cycling, helps strengthen the heart and improve circulation, leading to lower blood pressure over time. A heart-healthy diet is also crucial. Adopting the DASH diet, dietary approaches to stop hypertension, can significantly reduce blood pressure levels. This diet emphasizes plenty of fruits and vegetables, whole grains, lean proteins, low sodium intake, less than 2,300 milligrams per day, and healthy fats from sources like nuts, seeds, and olive oil. Reducing sodium intake while increasing potassium consumption can help balance the body's fluid levels and relax blood vessels. Potassium-rich foods such as bananas, sweet potatoes, and spinach are excellent choices for lowering blood pressure. Managing stress effectively is another key component of blood pressure control. Chronic stress contributes to high blood pressure by triggering the body's fight-or-flight response, which increases heart rate and tightens blood vessels. Engaging in relaxation techniques such as deep breathing, yoga, meditation, or hobbies can help lower stress levels and maintain a sense of well-being. Maintaining a healthy weight is also important, as being overweight increases the strain on the heart. Losing even a small amount of weight can significantly improve blood pressure levels. Additionally, limiting alcohol and caffeine consumption can prevent temporary spikes in blood pressure. Excessive alcohol intake should be avoided, with a recommended limit of 1 drink per day for women and 2 for men. Caffeine affects individuals differently, so it is important to monitor how it impacts your blood pressure. Getting enough quality sleep is equally important. Poor sleep patterns are linked to hypertension, so aiming for 7 to 9 hours of restful sleep per night can support overall cardiovascular health. Finally, quitting smoking is one of the best things you can do for your heart. Smoking damages blood vessels and increases blood pressure, but the benefits of quitting begin almost immediately, improving overall heart health over time. Keeping your blood pressure at a healthy level is one of the most important things you can do for your long-term health. Regular monitoring, a healthy lifestyle, and proactive medical care can significantly reduce the risks associated with hypertension. Remember, we are not medical doctors, and this information should not be considered medical advice. This discussion is for informational purposes only, and it is always best to consult your doctor for medical advice and treatment. They will have the best understanding of your individual health condition and can recommend the most appropriate interventions. If you found this information helpful, make sure to like, subscribe, Health Info Hub, and turn on notifications to stay updated with our latest health tips. Thanks for watching and stay healthy.